everyone, my name is Kristen Ackley and I am a doctoral student at the University of Arizona. I am also a speech-language pathologist, and I'm going to be talking to you today about my area of research interest, which is working with young adults who have sustained traumatic brain injuries. To give you a little bit of context, we will start with a little bit of background, then talk about injury mechanism and occurrence, symptomatology experienced by individuals who have sustained brain injuries, outcomes, the unique needs of this population, and then finally I'll put it all together by talking about some available resources and suggestions for use. So I always like to start with this framework by the World Health Organization. This framework separates the idea of all the things that we think about with traumatic brain injury into neat little packages. We're going to start by talking about the health condition, which is traumatic brain injury, and also talk about some of the impairments associated with traumatic brain injury. To provide a definition, traumatic brain injury is a disruption in the normal function of the brain that is caused by a bump, blow, or jolt to the head, or by a penetrating head injury. And young adults is a little bit of a messier definition, so it depends on who you ask, but if you ask the United States Census, they'll say it's anyone 18 to 34 years of age. Traumatic brain injury is traditionally categorized into severity level. We know that 80 to 90% of traumatic brain injuries are considered mild, although the symptomatology and the outcomes may not reflect that terminology. And so that severity classification is based on factors like loss of consciousness, memory, confused or disoriented states, and then brain imaging results. So you can see that in this chart there are a lot of ORs, so it's not neat, and the severity classification that someone has at the time of their injury may not be reflective of the symptomatology after. When we think about traumatic brain injury, we also think about two different kinds of damage. We like to think about them as primary damage and secondary damage. Primary damage occurs at the actual time of impact. There can be a variety of different kinds of damage that occur. A coup contra coup injury, for example, I always like to give the example because I think it's a really clear-cut one of someone driving, and if they hit their head on the steering wheel, the coup is going to be the point of impact, where the contra coup is the point where the brain hits the skull on the opposite side. That's a type of primary damage. You also have things like skull fracture, contusions or bruises, hematomas, lacerations, and nerve damage. In terms of nerve damage or axon damage, we can think of diffuse axonal injury. So what happens is that the head begins to move, but the brain is still. And during this time, there's a twisting and a shearing motion that occurs, and this is very damaging. And then once the head stops moving, this still continues to occur, and we know that that continues it can continue for 12 to 14 hours after injury. Well, why am I telling you about this? Well, when we think about young adults, first of all, many traumatic brain injuries result in multiple types of primary and secondary damage. And secondly, young adults get into car accidents a lot. One of the leading causes of traumatic brain injury in this population is going to be motor vehicle accident, and we know that the biomechanical forces associated with those accidents, so diffuse axonal, are associated with greater functional and neurological consequences. Okay, and so this chart on the left, to walk you through a little bit, is divided into age group. And unfortunately, our 18 to 34-year-old definition doesn't necessarily neatly fall onto this graph, but that's okay because we can definitely figure out where they might fit in. So we have 15 to 24-year-olds along the bottom here is where age group is, and then 25 to 44-year-olds. And on this chart, it looks like anywhere between 35 and 48% of young adults experience traumatic brain injuries as a result of motor vehicle accidents. So they're going to have greater consequences as a result of that. When we think about injury occurrence, young adults are also very likely to sustain traumatic brain injury in comparison to, for example, individuals 45 to 64 years of age. So not only are the consequences greater, but this group is also likely to have accidents in the first place. So when we think about recovery timelines, I like to be very cautious with the term recovery because it looks different for everyone, and it's really difficult to define in a population that's in transition. Young adults might not necessarily be thinking about returning to school because they may have just graduated from high school, or they may be transitioning to living on their own in an apartment, and the first day they sustain a brain injury. So really, what does a return to functional activity look like for someone who may be getting into a new routine? However, we have to think about what we do know when we're trying to work with or care for an individual who has sustained a traumatic brain injury. We can think about special populations. Athletes, for example, recover in approximately 7 to 10 days. And this is where that personalization really comes into play. So we need to think about, who is this individual? Is this individual an athlete? Well, maybe recovery looks different for that person then. Adults typically recover within 14 days, whereas children typically recover within 1 month. Again, we have this unique population that maybe falls in between those 2 points. So we don't have specific data on this timeline for that exact population, but we can kind of extrapolate from what we know. And a significant subset of individuals have protracted recovery, meaning they don't fit on this timeline neatly either. So we really need to be thinking, well, there are people from this group, there are people from that group who are going to have a protracted recovery. And this leads me to talking about symptomatology. Following a traumatic brain injury, a person may experience challenges in a variety of areas. We know that some of those challenges may be cognitive, so it could be attentional issues, it could be memory issues. We know that some of those challenges are physiological or somatic, so headaches, dizziness. We know that there are also socio-emotional issues that follow traumatic brain injury, so depressive symptoms, anxiety, things like that. And we also know that unfortunately in the real world, these symptoms don't play nicely together and they're not very neatly isolated. So it's not that someone has a headache and that's the only symptom that they're experiencing, but maybe someone has a headache and that's making their attention worse, but hey, they're in a job interview and their attention can't be suffering or they're not going to get the job. Or we know that sleep disturbances can really affect our thinking. I don't know about you, but if I don't sleep well the night before, I'm definitely not on my best game the next day. And it's problematic. There was a survey conducted by Hux and colleagues in 2017. And in this survey of 423 college students, nearly 30% self-reported possible mild brain injuries. That number is really staggering to me, and I think about it a lot because I work on a college campus. So pre-COVID, when I was walking around college, this campus, kind of looking at all the students, thinking in my head, wow, maybe 30% of these people have sustained a traumatic brain injury. And those are the people who self-reported possible mild brain injuries. So we don't know who didn't self-report in that survey. That is a really big number. And then out of that number, we had 11% who reported experiencing high chronic symptomatology. And I'm going to talk about what that means in a second. 49% reported moderate, and 40% reported negligible chronic symptomatology. So what does that mean? Well, the participants in this survey who reported high chronic symptomatology were more than 5 times more likely than their peers with negligible or moderate symptomatology to report issues with memory, processing speed, learning new information, and paying attention. And although they endorsed these issues a little bit less often, they were also more than 5 times more likely to report problems with organization, multitasking, focusing their eyes, balancing, and they also reported having flashbacks. If we think about what these individuals are trying to accomplish on a daily basis, going to classes, socializing with peers, and you've got all of these symptoms coming into play, it's going to really impact their performance in different areas. And so that is why when we think about brain injuries, I think it's really important to think about what symptoms the individual is experiencing and try to capture that information via interview, by asking the person, you know, this assessment that I just gave you says X, Y, and Z, but what is the reality for you? What are you finding to be challenging? Just so that we can get at some of these underlying issues. Because I can tell you that if learning is an issue or processing speed is an issue, maybe it's not that the person can't understand, maybe they need to address those underlying problems before they can be successful in their environment. In 1999, which is quite a while ago, that's okay. I think this data is really important. Backhouse and Roger conducted focus groups with young people who had sustained acquired brain injury and their parents. And what they found was that most participants reported a lack of support from allied health and educational professionals throughout the continuum of hospital to school and school to work transitions. That's really meaningful. I would hope that we have come a long way in the past 21 years, but I think that we need to be very cognizant of this information as we continue along this journey, because the people that we're doing this work for at the end of the day are young adults with acquired brain injury and their parents. And if they're not feeling supported, then we need to reevaluate our procedures and what we're doing. All parents in this survey, or in these focus groups rather, reported high levels of stress related to their child's schooling and future employment, and many young people reported unmet needs. Again, we need to be addressing these concerns, and hopefully we can reduce some of this by amping up our game professionally. And I will, like I said in the beginning, talk about some tools and some ways to do that to make people feel heard and to kind of address these concerns. So we're going to change gears a little bit, and using that framework, we're going to transition to the activity and participation components of this model. Activity refers to a specific task that an individual might have to undertake, whereas participation is a role that someone plays. So for example, participation might be working full-time as a store associate. That's participation. Whereas the activity might be stocking shelves, for example, as a specific activity. And the reason that that's so important is because there are so many roles that young adults play, and in each of those roles, there are a ton of activities or tasks that they are required to do. I like to call this population adult adjacent, and there's a lot of reasons for that. I'm going to start on the left-hand side here. So there are some transitions that these individuals are undergoing, maybe to working full-time for the first time, or part-time for the first time, you know, or just maybe cutting back hours, who knows. Academic, a lot of young adults are taking college classes or going to college full-time. Socially, their worlds are changing, so there's no longer that forced, let's get up in the morning and go to high school, and you know all the people are there, but now their social lives look a little bit different. So they're managing all these new roles. There are higher demands placed on this population. Even something as simple as creating a password for a job site or for a college application site can be really demanding on my best of days. So for a college student or a person working who has had a traumatic brain injury, this can be really difficult. And then, not to mention actually filling out an application is a really tasking activity. Their roles are multidimensional. So just like their symptoms, their roles don't occur in isolation, right? So someone who is a college student is also maybe still working, is also still a friend, needs to maintain relationships with their parents or their family or whoever. So again, their lives are multidimensional and evolving. We talked about less social support a little bit, but there's also less guidance, and I think that these two play together. So, for example, if someone sustained a traumatic brain injury in high school, that person may have had an individualized education plan or an IEP. The person may have had a 504 plan in effect, and now all of a sudden that's not there anymore. The guidance counselor, the teachers aren't checking in to say, hey, how are things going? Did you turn your homework in? Those kinds of supports aren't there. There's also, again, not forced social interaction, but that structural built-in social interaction that happens. So these can be really difficult times for people, especially after a traumatic brain injury. So I alluded to this in the previous slides, but this slide's purpose is really to emphasize the number of roles that young adults play. So we think about them as being friends. We think about the fact that they've just graduated high school and there's probably a lot of emotions associated with that. Or maybe if they fall into that higher range in terms of young adult, there are other transitions happening. We think about the fact that they've got to manage their own schedule, most likely. Many of them are moving into their own apartments or moving in with friends, and they've got to navigate those roles. They may be working full-time or part-time. I mentioned the password example of, logging into these sites, creating accounts, trying to manage all of these things. They've still got to make sure that they call their mom. These kinds of things are really demanding. So we can think about these demands, but I think that it's really important to consider the actual tasks that these young adults have to perform. I went on Indeed and I found a couple of job postings because I think that this really highlights the number of different cognitive demands that we place on individuals. This is an example of a posting for a store associate. It talks about remaining alert and engaged, okay? In my head, I'm thinking that person needs great attention. It talks about being confident, being organized, answering questions, learning, visually monitoring a store environment, and verbally communicating effectively. Just those terms alone, for someone who is having any kind of cognitive deficit, those are demands that maybe they can't meet, or maybe they feel like they can't meet. So it's really important to get at what these underlying issues are, address them early and address them often to make sure that this person is going to be able to be up to the task. Maybe, let's say, the person completes the application and gets into the door and has an interview and does well and gets the job, but then are they going to be able to experience success in that role, or is it going to be overwhelming, and is it going to be a problematic situation where it results in job loss, or any kind of just negative environment? We need to make sure that as people trying to support individuals with traumatic brain injury, that we really address these concerns and we also address the demands of the roles that these individuals are playing. Some job advertisements are a little more subtle in their requirements, and they may not explicitly state that someone needs to have good organization or be alert. However, those things are clearly implied when you read the full job advertisement. So for example, even just one of these bullet points, use our sales and marketing guidelines to increase sales and reach goals. sounds very tangible, but what that requires is it requires good attention when reading the guidelines. It requires organization to know, okay, what do I need to be thinking about? It requires working memory to be able to store that information, and it requires a whole slew of other skills. I won't go down the list because it could take me a half hour in and of itself, but I think it's really important to kind of work with individuals who are trying to transition into a vocational role and think about what are some realistic expectations for jobs that you may be able to apply for, and what are the demands of that job. And then again, I kind of went down a rabbit hole with this, but third posting for a sales associate was just excellent oral and written communication and good time management. These little bulleted items might sound really simple, but they're very complex. We're going to transition a little bit and talk about outcomes. So we've talked about a little bit of background information, we've talked about symptomatology. Well, what actually do we know about where these individuals end up and how do they compare to their peers? So we know that for students, for college students with high symptomatology, that these individuals fail more classes than their peers, repeat more classes, and have lower grade point averages than their peers. There was a study done in 2017 by Brown and Hux where they examined the note-taking skills of college students, and they examined the use of PowerPoint support for those students. And all of the students had acquired brain injury. They started with a human biology pre-quiz, content quiz, I think it was 10 questions. And then they had the students listen to a lecture and take notes. They gave them a 5-minute study period. And then following that study period, they asked the students to verbally summarize the information that they had learned. And they gave them a 10-question post-quiz. And what they found was that college students with TBI demonstrated increased knowledge and new learning following lecture-style content presentations. And I love that finding because it demonstrates that college students with traumatic brain injury can learn from lecture-style presentations. That is meaningful because that is how college students need to learn. And it means that we know that this is an achievable goal, right? That this task is something that we can get to, maybe not for every individual, but for individuals who have sustained TBI. There were some mixed findings with regard to the PowerPoint support. They found that some individuals did really well with PowerPoint support. It helped them with their attention, it helped them with retaining the information or comprehending the information. But then for other individuals, it did the opposite. So I think what that indicates is that it's really important to consider the needs of the individual. And there have been additional findings that have shown that this individualization is key when we think about external supports. So considering the preferences of the person, considering what habits they're already in. I always ask clients who have TBI, do you use your phone? Do you use the calendar function on your phone, or are you a planner person? Because if the person has never touched their calendar app on their phone, I am not trying to increase the cognitive load on that individual by saying, let's learn how to use this app. I'm going to say, hey, let's pull out that planner in your bag that is super well written in that you've been using for 5 years so that we can just continue with the strategy that works for you. Some individuals we know actually prefer kind of a medley of the two. So they maybe prefer using a planner for maybe their to-do items for a day, but then they also like having a calendar function to remind them of appointments. I keep rehashing this point, but it is really important to make sure that you get at these items, or what's going to happen is you're going to have a person sitting in a room and you're going to say, I know this strategy, it works really well. It's so great, and they're going to walk out of the room and never use it again and not be successful. We also know from this particular study that evaluating performance is with various types of academic support like I'm talking about may help people planning to return to post-secondary settings. This isn't just information general to adults, but it's very specifically targeted towards people trying to return to academic settings or enter into academic settings in young adulthood. And then again, individualized education, assessment, and treatment approaches are needed. So we need more research in this area. When we think about young adults who have high symptomatology and are thinking about vocational roles, we know that they may experience lower quality of life, job loss, and impacts on health and/or self-identity. These are not items to be taken for granted. We really need to think about the fact that the impact that job loss can have. And I do think that COVID-19 has helped us to increase our awareness of the impact of job loss, but this is a population that maybe has felt that for a longer period of time. So I love this quote. This is from a TED Talk actually by David Henry. If you have time, I highly recommend looking at it. He says in his TED Talk, every doctor concluded that I would never work full-time again, especially not as a truck driver. So just thinking about the impact of what that might mean for an individual is huge. If I knew that I could never work again, I think I would be impacted in all of the areas that we mentioned. So self-identity, I think I would be experiencing probably some socio-emotional impact, not just from my injury, but from that too. So it can serve, this kind of experience can really be problematic. What that means is that we need to think about the resources and how we can help these individuals. And so in 2017, Ruitt et al. Examined these outcomes more specifically with individuals with severe TBI. So 4 years following severe TBI, 38% of these individuals were in paid employment. Severe TBI does not necessarily account for a large portion of individuals with TBI, but I think that that is still a very meaningful statistic. It's problematic for a variety of reasons, but it also points to a need for more research. We need to figure out what's going on. What are the factors that are contributing to such a statistic? Well, we know that return to work post-severe traumatic brain injury is often unstable and that there are a lot of difficulties experienced by these individuals. So we talked about symptomatology, but more specifically, we need to be considering different factors relative to that person's job performance. That is where environmental factors and personal factors really come into play. There are a lot of barriers that may serve to negatively impact someone's success in a vocational role. And these include the number and severity of impairments that a person is experiencing. So fatigue can play a really big role on the number of hours that an individual can work for. I work in my research mentor's lab at the University of Arizona, and through her lab, I was helping run a concussion clinic. And one of my clients was a nurse who was attempting to work 12-hour shifts, as is typical. I think all the nurses I know work 12-hour shifts. And she was just finding that she couldn't work. She couldn't go back to work. She had a mild injury, but she was unable to work, and she didn't realize it until her third 12-hour shift. But she definitely was feeling the fatigue. She was having headaches. She was having all kinds of symptomatology. And so eventually, after therapy, after working to manage some of those symptoms, so she was also seeing a couple of other professionals, she was able to return to work, but it definitely took some time, and it also took some flexibility on both her part and the part of her employer. And what I mean by flexibility is her employer had to have understanding, and they had to be creative. So she was very lucky. Her employer was actually able to offer her an administrative role for the time being. So she kind of transitioned in a stepwise manner back into working. She started by doing some of those administrative tasks, not working 12-hour shifts. And then once she kind of had a handle on that and was able to get back up to around 10-hour days. They transitioned her back into her nursing position, and they gave her those 12-hour shifts. But like I said, she got very lucky, and her employer was understanding. The length of recovery time may vary. We saw that chart earlier with the arrow. We don't know what the recovery time is going to be for any given individual. It may be related to exercise, it may be related to their age, but we know that we need to be kind of flexible and ready to work with the individual to support them in whatever way they need. Lack of understanding about brain injury within the employment sector is a really big problem. In that example, the employer was very understanding, but in some cases that might not be true. Something that came up actually when I was preparing this presentation that I hadn't even thought about, and I think about this population all the time, was that someone who is located rurally has a limited amount of job vacancies that they can feasibly apply for, right? So location really impacts this. And poor public transportation options really impact this. So if we go back and think about some of those, especially the somatic symptoms that somebody might experience, so a headache or vision concerns, that's going to impact somebody's ability to drive. And that means that if you live in a place with poor public transportation, that you're really limited in the places that you can apply for work. And then a lack of opportunity to develop work readiness. So who is going to give you those skills? Who's going to support the individual and get them ready to go back to work? I can try as a speech language pathologist to provide some help with communication, with attention, with all kinds of cognitive areas, but I can't necessarily tell you what you needed to do technically in your very specific position, right? So that's going to be a real teamwork effort. What do we do with these individuals? How do we help them? How do we support them? Well, first, I think it's really important to consider all of the different roles that individuals may play. So we have all these different professionals, and I think we need to be thinking as professionals, what is my scope of practice? How can I share my expertise? But how can I also support this individual by referring them to an appropriate person? So as a speech language pathologist, I know what my scope of practice is, and I need to be familiar, for example, with my colleagues in audiology, with my colleagues in occupational therapy, to refer enough to refer someone when it's appropriate. Or if I'm not sure, I'll refer them anyway. And then that professional can make that decision. We know that services provided for students with TBI in school settings often focus on academic success, right? So generalized academic accommodations. And I like to call this service-centered thinking. So this is really thinking, well, what do we do? Okay, we need to get this person graduated. So let's think about how to support this person to graduation. Okay, we did it, we're done. But they're not necessarily placing emphasis on future transition to higher academic or vocational settings. So it's not person-centered, and it really needs to be. So we need to be thinking, well, what are your goals for the next step? How can I support you in that transition? All of my conversations that I have with clients don't center on, well, I want you to get better in 8 therapy sessions, but they center on, well, where do you want to be in 2 months? Or where do you want to be in 1 month? Or whatever it might look like. And how can we work to get you there, to that specific place? And the tools that I'm going to provide at the end of this are going to help us as professionals, as caregivers, as just individuals to support people with TBI to get there. Our goal is to facilitate a return to functional activity and independence. Like I said earlier, this looks different for someone in transition, but I think it's really important that it's still our goal. We still want this person to be functional in whatever they choose. Metacognitive strategy training is very important, so we need to be thinking, maybe this person, so metacognitive strategies are just ways to help a person develop self-awareness. So how well or how poorly they're performing in an area, and self-regulation. So if I know that I'm performing poorly or I'm not doing this task like I need to be, can I regulate, can I recognize that, and can I kind of try to fix it? So I think a really good example of this is something that I do all the time. So I like to read, and if I'm reading something and I'm not paying attention, I don't know if you've ever had this experience, I get to the bottom of a page and I realize I have no idea what I just read. I was not paying attention at all. I stop myself and I go back to the beginning. That is actually a strategy, and I think that, so it can be something as simple as that, or it can be, let's use a tool, let's write down when you're experiencing headaches, and you can think to yourself, maybe I shouldn't study at 3 p.m. because I tend to get my headaches around 3 p.m. So those kinds of strategies are important. We know that a pen and paper test, a standardized test can be really helpful, but we also know that it's important to consider what is ecologically valid. So maybe looking at how we can gain information about the tasks that these individuals need to perform. So even if it's informal, I might ask someone who, if I say, oh, do you have any problems with scheduling appointments using your calendar? Okay, because that's actually something that requires a lot of skill. And they say, oh no, I'm fine with that. I might say, oh, can you just go ahead and schedule your next therapy session on your phone real quick or on your calendar so I can just see what that looks like, just so that I have more of a third-party perspective. And if it takes the person 20 minutes, then I know, hey, we maybe have a little bit of a misunderstanding here. But if they do it in 30 seconds flat, I'm not concerned. And then considering personal preferences and contextual factors and collaborating with other professionals, with families, with friends, with caregivers, with whoever is important in that individual's life. So we also need to be providing continuous support. Our support doesn't just stop all of a sudden because we decided that it does. We need to be ensuring that through this transition, the person feels supported. They can always call or email you or me or whoever after they're done. So for example, when I discharged the nurse that I was talking about from therapy, she emailed me about 3 months following just to check in, and I really appreciated that because I knew that she was still working, she was doing well, but it also was a way, me responding was a way to say, hey, I still care and I'm here to support you. Positive relationships are really important. We can think about options like work trial or volunteer work placements. So maybe as kind of that stepwise transition back into work, maybe an internship program might be appropriate. These kinds of options exist. And then on-job training and assistance with written documents like a resume. I actually kind of nag my husband about this all the time. He's a supervisor, and I always say to him, well, what support are you giving that person? Are you helping him if he has a new interview for a full-time position in 2 weeks? Are you going to help that person? Just because I feel like, if that training and assistance can be given, then I think it should, and especially with this population. These are some resources specific to Arizona. This is, the first one is about vocational rehabilitation. And then these are some disability resource centers at some of the major universities. But I have to say, it is very easy to find. So if you Google the name of whatever local college or university or educational institution and then disability resources, you will find a website. So not hard to find, and I think they're really good websites. I kind of tried to navigate each one of them, and they're pretty easy to navigate. So look for that. What are the takeaways? What are the tools that I'm going to give you? Well, first, motivational interviewing. So the rules of motivational interviewing are pretty simple. The first one is to resist telling the person what to do. Really listen to the individual. I am not in an interview to gain more information about how I deliver clinical expertise. I'm in an interview to learn about this person and to figure out what I can do to support that person. It can look differently, but it involves active listening. It involves kind of responding to what the person is saying. So if the person is saying, for example, I had an individual come into our concussion clinic who said, well, sometimes I just pace around my apartment because I don't know if I should be doing my laundry or if I should be doing schoolwork or if I should be painting or if I should be making dinner. I kind of said, well, it sounds like you're having some problems maybe with organizing your time. Can you tell me more about that? And then we went down this whole long rabbit hole, but it was a good rabbit hole, about his time management overall and what that looked like in different settings. So just kind of those open, questions and really listening. Understand their motivators, so try to understand barriers to changing behaviors or understand what motivates them. So in that example, I knew that person was really highly motivated. He was very, very intelligent, and he was a researcher, so he really wanted to talk about his research, and I used that as a motivator for him. So we would talk about, how he could be more successful in his research. Listening with empathy, so, trying to understand what are the values, what's this person's highest priority, and what are their needs. And then empowering the individual. So again, it's not about how can I, get this person out of my door, but it's really about how can I set achievable goals, how can we set achievable goals, and how can we, facilitate the achievement of those goals. Goal attainment scaling. We have here, this template is available, but I also have put my email address at the beginning of this PowerPoint. So if you want to email me, I am happy to send you any materials. I really love goal attainment scaling because you can personalize it to any goal. The examples I give in this presentation are time-based, but it can be the number of times that somebody does a certain task. It can be not doing something, so it can really be personalized. But basically, you have more than expected, which is where I usually set the goals. We know that right now, for example, a person is doing X, Y, and Z. Well, that's going to be expected because it's par for the course. It's where they're at. But we want to get them to a place that's more than expected or much more than expected. Or if it's an adverse behavior, like saying inappropriate comments, maybe we're aiming for less than expected, or maybe we're aiming for much less than expected if it's in a classroom setting or a job interview, for example. So really tailor this to your individual clients or the person that you're trying to support. Thinking about what those goals are is really going to help you with this, and I will walk through some examples. So then the goal is, what do I want to accomplish? The plan is, how am I going to accomplish it? And the materials and equipment necessary for that are going to play into the plan. The steps and assignments are going to be, how do I get there? The problems that arise and the solution are going to be actually something that the person needs to reflect on. So as they're doing as they're trying to perform whatever task, what's going on? And then review is something that you will review with the individual following the achievement goal of the goal. So this is aptly named Goal, Plan, Do, Review. And it's a process that can be personalized, and I'll go through it. So I will give a couple case examples here. This is an individual who I have assigned a pseudonym to. This individual is a 20-year-old, or was 20 years old when I saw her. She was struck in the head by a customer at her part-time job as a server, and she was a full-time college student at the time that I saw her, and she was in the ROTC. Michelle played a lot of roles. So her goals that we talked about in our session were to study for 1 hour, 5 times a week for her anatomy class. And then she was also feeling really isolated from her friends. So she wanted to talk to one of her friends a day over text message or in person, because she was feeling like she was self-isolating. She wasn't necessarily feeling like, oh, people have withdrawn from me. It was really more about she was kind of forgetting to maintain those connections. For goal 1, which is studying for anatomy, Michelle used her anatomy textbook, her anatomy slides, some scrap paper, a pen, and a quiet space. Her steps were to set a timer on her phone so that she would know how long she had been studying and how long she had left, to open her most recent slides from the class, to make a mind map. So she really preferred kind of this one study method that we had talked about to study. So that was her plan. She was going to do that. And then to write down questions as she went. So if she was really confused about a topic, she would write them down on a separate piece of paper to keep them organized. and then to continue until the timer stopped, but she did take 2-minute breaks as she needed. So when she actually planned the steps for goal 2, it looked a little bit different, right? It was a little simpler. She had her phone, her friend's number, and if meeting up with a friend, she had money. She set a reminder on her phone to text or meet her friend, and then she actually did that action, and she tried to repeat this every day. So as she was performing these actions, she found in the anatomy studying that it was really hard for her to study at home. So she lived with her family, and her mom was always coming into her room to say, you need to be eating dinner, or her sisters would come in and try to talk to her, and she just found that to be incredibly distracting, as would I. For her solution, she began studying at the library on campus, which I thought was really great because it actually served 2 purposes. So I'm gonna skip down to the third one here, but her symptoms made it difficult for her to study at night. So she planned study times during the day, and so she could do it while she was on campus in between her activities. So she had ROTC super early in the morning. She would go to the library and study right after, or in between classes or after classes, to try to get some of that done in a quiet environment and before she had some of those, that fatigue would set in. She did find that having her phone out was really distracting for her. Remember, she had set the timer on her phone, so what she did was she actually downloaded an app that restricted her use of social media, which I thought was really smart, and she disabled her notifications on her phone for her email. So it was just really more about, like, if I can't access it, then I won't. In terms of her second goal, which was more social, her friends weren't always available, so she would sometimes solve this by texting a different friend, and also her timing made things difficult sometimes, so she would like text somebody and then all of a sudden realize that in 10 minutes she had to be in class and she couldn't really be having a text conversation. So she did something which I thought was really wonderful and really important. She was very flexible, and she just gave herself credit for trying. So I thought that was great, and it was a super nice takeaway. So in terms of review, this is very subjective. This is just kind of a ranking system. So 10 is I did great, and 1 is I did not do great at all. She gave herself an 8, but I gave her a 10 because I thought, you know, you're really problem solved here, and you met your goals. But she was very hard on herself, so she would say things like, well, yeah, but you know, there was one day where I only studied for 30 minutes or things like that. But there were always really, really good reasons, and she was always problem solving to get to her goals. So use your judgment on how you want to use that portion of this tool. So then we set her goals as more than expected. When we used this goal attainment scaling, much more than expected would have been something like 7 days a week of studying, or twice a day texting friends. Definitely not unachievable, and those could make really great longer term goals, but I think for the short term, we really wanted it to be achievable. So we set that at more than expected. And then, of course, less than expected would be less times or maybe less duration. So it can be really flexible, like I said. In the second example, this is an individual who is 23 years old. So this is a hypothetical example. I'll just be very honest. I'm going to say he sustained a TBI in a motor vehicle accident. He is a full-time store associate. Jonah wants to be on time to work every day, and he wants to pay his electric and internet bills every month. The materials that he might need are things like a phone, a lunch, keys, and wallet to be on time to work, and he needs to set alarms on his phone the night before to remind him to do all of those tasks. And then some materials and equipment for paying his bills on time would be having apps on his phone and using his credit card information So he needs to make sure he has that credit card out. I think we've all had the experience of going onto a website to do something and you realize you've got to get up and go get your credit card, or you have to get your driver's license or whatever it may be. Making sure he had that ahead of time, I think, would help. Sometimes it can be really frustrating to not experience success or to realize that, oh, this is going to require more than I thought it would. So installing apps and setting up the accounts would be a good part of the plan, and then setting up payment information to pay bills when reminded. Some problems that might arise with being to work on time are problems that everyone experiences, but maybe traffic being unpredictable and forgetting to prepare the night before. So walking out the door without your lunch or walking out the door without your keys. Some solutions could be leaving home earlier, and then the solutions could be, setting those alarms to prepare the night before. So not just prepare the night before, but maybe set an alarm for 7 p.m. because you're going to be, getting up from the dinner table, for example. And so it might be a good time. And then again, that's kind of where that metacognition or thinking about thinking comes in. Well, I know that at 7 p.m. I am going to forget things, so I need to set an alarm. And then goal 2, some problems might be that app reminders happen at an inconvenient time, right? So I think I've definitely had the experience where an email comes up that's really important, but maybe I'm in the middle of doing something else. So I need to remind myself later to address that. And then so setting a personal alarm or a reminder for a later time, even a sticky note, whatever system works for the individual. If your credit card expires when you have it entered into a system, that can be a problem. So, setting aside time to put in that new information. I did not complete a review session for this person because it would be personalized to the individual. So to wrap it all up, we know that young adults experience more TBIs than some other individuals. We know that they are likely to sustain these TBIs in motor vehicle accidents. We know that without management, that symptomatology may restrict participation or activities, success in different roles or different tasks. And we know that this population has very unique needs that we need to consider, and that without help, individuals might experience negative outcomes. But we also know that there are many services and many resources available for this population. So I really enjoyed speaking to you today, and I hope that we can kind of move along the journey to better care for young adults with TBI together.
Hi, my name is Brittany Sweeney Lawson, Resource Facilitation Manager for the Brain Injury Alliance of Arizona. Thank you so much for watching our presentation today. We hope you found the information helpful and that you'll be able to use it moving forward. If you are seeking continuing education credits for this presentation, please return to the video's launch page and click on the post-viewing test. This will bring you to the content-specific questions to complete. Once you have achieved a passing score, you will receive the instructions for obtaining the certification paperwork through our CEU Management Group Empowerment Research. Again, thank you for your time, and remember, if you have any brain-related questions or resource needs, contact us at the Brain Injury Alliance of Arizona.